There are 1/4 of Americans will report having chronic knee pain. Things I'll hear is, I just have bad knees. They always hurt me when I'm going up and down stairs, getting out of a chair, or squatting down to pick something up. Heck, it's a beautiful day out here. I figured it's a good time to go for a Sunday stroll, and let's talk about some chronic knee pain. Before we get into the meat and potatoes of this, I think it's important to talk a little bit about chronic versus acute. So these are terms that generally mean something that's acute is relatively new or a fresh injury. For instance, last week I stepped off a curb and twisted my knee, and it's been bothering me or inflamed ever since. Or 2 weeks ago, my son was playing basketball, or my daughter was playing soccer and got tangled up with another player, and their knee's been bothering them ever since. Or even last month, I slipped down a flight of stairs in my home, and my knee's been really bugging and inflamed ever since. Those are fresh injuries, so we want to look at what is the pathology, what structures were damaged, what was harmed, versus chronic. Well, chronic is something that has been there for a longer period of time. Sometimes there is a specific incident, but it'll sound more like last year or 5 years ago or 10 years ago. I went skiing and my knee's been hurting on and off ever since. But most often, there's not a specific incident that they can remember. It's more of my knee has been bugging me whenever I go and do prolonged activity, and it's just gradually gotten worse and worse over time, right? So this is important to differentiate, because the way that we treat is definitely different. If there's an acute problem, like I mentioned, we want to look at a specific pathology. So we want to look at what structures were overstretched, what structures were torn, was there any damage done inside the knee joint? Versus a chronic problem, we're looking more along mechanics. So we're looking at what structures are tight, what structures are weak, what structures are also, there might be some damage in there, but it's a little bit of a different perspective. With an acute injury, something that's fresh, we may want to stop whatever activity there was. So in the case of basketball, we might want to take them away from basketball and allow those structures to heal, right? If there was a significant damage or a significant tear, maybe they need surgery in order to fix the problem. In the case of a chronic issue, if they don't really know what the problem came from, what typically happens is, while rest might make them feel better in that moment, slowly but surely over time, their functional activities get whittled away or get taken away from them little by little. For instance, you might hear a person say, my knee started hurting whenever I would go run for my 2 miles. I would run 2 miles 3 times a week, and my knee started hurting at about mile 2. So I stopped running 2 miles and I only ran 1 mile, and then it started hurting after 1 mile. So I stopped running and I just would go for recreational walking until that started hurting and I stopped walking. So then now it's to the point where I can't even walk from my front door to my car before my knee starts hurting. So functional activity starts to get taken away from them as their knee pain starts to become more and more invasive or intrusive into their day-to-day lives, right? So rest isn't necessarily a good option at that point. Most often, chronic knee problems stem from a tracking problem. So usually it's not necessarily a tracking problem at the knee even, but it stems from a tracking problem at the joints either above, which would be the hip, or the joints below, which would be the ankle and the foot. When I talk about tracking, I use the analogy of, those sliding glass doors that some of us have in the backyard. If you look down at the bottom of the track or the bottom of the door, there's a track that the door has to be fitted inside of. And if that door isn't balanced just right or installed just right on that track, well, not only is the door harder to open and close, but if you keep using that door over time, then it can actually cause for some breakdown of the mechanics. So the track might get a little worn, or a wheel might get a little bit worn, and over time will maybe break down, start to break. You might have some fraying or some chipping away of the track, so on and so forth, until the door just becomes completely unusable. Well, when it comes to the knee joint, if the track is not appropriate, or the mechanics aren't good, or the biomechanics are faulty, slowly but surely you start to cause some wear down, some breakdown. Some of our structures start to get worn thin, and so on and so forth, and that leads to the pain. So let's dive a little bit deeper into the mechanics of the knee. For the most part, the knee is a relatively simple joint, especially when compared to the hip or the knee, in that mostly it just extends and flexes. So you straighten your leg out, extension, you bend your knee, it flexes. There is a little bit of rotation involved in that, but for the most part, that's what the knee does. Now compare that to the ankle. You can pull your foot up, you can push it down, you can move it to the inside, to the outside, you can rotate it around in a circle. Same thing for the hip. You can bring your hip forward and backwards and out to the side and inward, and you can rotate it. So those are definitely more complicated joints. All the structures that are inside the knee are really designed to make sure it moves only in that extension and flexion. So you have tendons and ligaments that are really try to help stabilize the joint so that it doesn't have these wrong movements. If you have faulty mechanics or weakness or a mobility problem at the hip, it can stress these structures down at the knee. Same thing with the ankle and the foot. If the ankle and the foot are not moving correctly, or there's a weakness or a mechanical fault at the ankle or the foot, it causes more stress on the knee. And what happens is you may not have pain right away, but if you keep using it, just like that sliding glass door with these faulty mechanics, it's only a matter of time before inflammation starts to set in and pain starts to set in, and you're no longer able to enjoy going out and doing the activities that you want to enjoy. So to oversimplify what we do, or what you want to do for this, is really you want to make sure you have good strength, you have good range of motion or mobility, you have good flexibility, and you have good stability. Not only at the knee, but more importantly, almost more importantly, at the hip and at the ankle. And if you fix those, that'll pretty much set you up to have a good success at fixing the chronic knee problem. 90% of the pain is typically from the joint above and below, and not actually from the knee itself. One of the ways that you can test this is you stand perfectly still in front of a mirror, take your socks and your shoes off, and you want to be able to see your entire body. One way to test your stability of your hip, your knee, and your foot is lift one foot, stand perfectly still for a period of 30 seconds, 45 seconds, a minute, 2 minutes if you're able to, and look to see how your hips respond to that stress. So you are looking for a good level balance here. If something is dipping or caving, you're looking for how straight can your leg maintain? Is it curving in or curving outwards? And you're also looking at the bottom of the foot to see if your foot is rolling inwards, if you're putting more pressure on the toes, on the heels. Are you able to maintain your balance at all? And that can be a good indicator, a clue as to how well your stability is, your strength is at the hip, at the knee, and at the foot. And that's a great place to start. If you find that there's some mechanics wrong, you might have some knee pain, it's a good time to work on it. It's a good time to come and see me.